I'm Nirav Shah from the Maine CDC. I'm joined this afternoon by Commissioner Jean Wambrew from Maine's Department of Health and Human Services. Commissioner Wambrew and I are pleased to be with you this afternoon to talk about where things stand with COVID-19 for today, Wednesday, November 17th, 2021. Right now, across the entire state, there are 113,132 cases of COVID-19 that have been logged. That represents an increase of 1,042 new cases of COVID-19 since yesterday alone. That is among the highest one-day totals of new COVID-19 cases that Maine has seen throughout the pandemic. Across the state right now, 280 people are currently hospitalized with COVID-19. That too is a new high mark throughout the pandemic. To put that number in perspective, 2 weeks ago, there were 212 people in the hospital, and today that number is at 280. Right now in the state, there are 77 people who are in a critical care unit bed. 2 weeks ago, that number was where it pretty much is today. 2 weeks ago, it was at 76. Similarly, right now, there are 36 people on a ventilator. And 2 weeks ago, that number was at 37. Of all the individuals who are in a hospital right now, 5 are under the age of 18. And 2 of those 5 children are in the pediatric intensive care unit right now. In terms of testing, our 7-day PCR positivity rate for the entire state now stands at 8.9%. That too is the highest point that it's been at since the beginning of the pandemic. To put that number in perspective, 2 weeks ago, our PCR positivity rate was 5.9%, whereas today it stands at 8.9%. Our testing volume for PCR tests is at 594 PCR tests that are being conducted for every 100,000 people. That number has increased in a good way. 2 weeks ago, the volume was 500. So we've seen a 19% increase in our PCR testing volume just over the past incubation period, or that 2-week period. Turning now to vaccines and vaccinations. As of this morning, 71.6% of the entire population of Maine was now fully vaccinated. And about 79.5% of the entire state has received at least one dose of vaccine. Right now, statewide, Maine is administering about 8,800 doses every single day of all the COVID-19 vaccines. That includes first doses, second doses, booster doses, and now pediatric doses. That's an increase of 21% just since the past week. Over the past 7 days, we've increased our volume of vaccine administration by 21%. We've made strong progress on the latest group to become eligible for vaccines, and those are children between the ages of 5 to 11. As of this morning, 14,209 kids in Maine between that age group have received their first shot. That's about 14.6% of the entire population of kids in Maine between the ages of 5 to 11. We are off to a strong start there. We just want to keep that momentum up. And before Commissioner Wambrew and I turn to questions, I wanted to take a brief minute to offer a short diatribe on boosters. I have some news to share on eligibility for COVID-19 booster shots. Governor Mills announced earlier today that effective immediately, all Mainers 18 and up who got the Pfizer or Moderna vaccines at least 6 months ago are now eligible for a booster shot. Now, there are a few reasons why we're doing this. The first is that recent data from the US CDC and the Maine CDC continue to both show high, sustained rates of community transmission across all of Maine's 16 counties. On top of that, there's evidence that the protection provided from COVID-19 vaccines may fall just a little bit as time goes on. That's not unique to the COVID vaccines. That happens with many vaccines. But here in Maine, our circumstances are interesting and unique in this sense. In Maine, we leapt out of the gate in launching our vaccination program. Honestly, I can't think of another state that hit the population level vaccination milestones, 10% vaccinated, 20%, 40%, 70%, as quickly and consistently as we did. We started out on top and have largely stayed there. But here's what's interesting. Because we vaccinated a lot of people, and we did so early on, the potential for some drop in effect may be more pronounced here in Maine than perhaps in other states. That's where boosters come in. The booster shot can help provide an extra immune system boost to folks who are at least 6 months out from their second shot. The second reason we're doing this is for clarity. In recent days and weeks, Maine CDC has received phone calls from individuals who are absolutely eligible for a booster shot, but couldn't interpret the criteria. What this meant was that there may have been folks who were eligible before, but who were sitting on the sidelines because of the lack of clarity. Today's move addresses that. So what does this mean for you? First of all, if you're 18 and over and you got your second dose of Moderna or Pfizer vaccine at least 6 months ago, you can and should go get a booster. This is effective immediately. It is that straightforward. Boosters are available anywhere that's offering the COVID-19 vaccine, and the vaccines available remain available at no cost to you. Now, the one thing I wanted to note for folks is that this is the first day of this change. And as with any change, it may take vaccine providers just a little bit of time to adapt their IT system to scrap the previous criteria for booster eligibility and just replace it with the new question, which is, are you over the age of 18 and did you get your second shot of Pfizer or Moderna 6 months ago? That may take just a bit of time. So as with all changes, we ask folks to be patient. The other question that I wanted to note is, what if you got the J&J shot? Well, you remain eligible for a booster at least 2 months after you got your first dose. That doesn't change with today's announcement. If you got the J&J shot at least 2 months ago, you can and should go get a booster. And one final reminder, on all boosters, you can now mix and match vaccines. So if you got the J&J shot 2 months ago, you can get Pfizer or Moderna or J&J for your booster. Similarly, if you got the Pfizer or Moderna shot 6 months ago, you have your choice of which booster you may want to receive. The bottom line here is that it remains important to go get a booster. Today's move is supported not just by the epidemiological evidence, but also will help clear up any confusion about who is eligible. So with that, we will turn to our colleagues in the media for some questions. And today's first one goes to Eric Russell.
Good afternoon, Dr. Shah, Commissioner Lambert. Thanks for taking the time, as always. Today's announcement about boosters certainly is a boost, no pun intended, for people who have already been vaccinated. But as you guys have said multiple times before, we really need to focus on the unvaccinated population, of which there are still close to 400,000 people. And we know that they are the pockets that are driving transmission. So short of, more restrictive lockdown measures, what can be done to reach those individuals or to mitigate some of the spread that we're seeing? Or do we think that this announcement is going to mitigate some of that spread?
Commissioner, please go ahead.
Sure. I'll start by saying nothing about today's announcement stops or changes our work to first and foremost get people to get their first dose, or if they're doing a 2-dose series, second dose. We know that is critical to protect people from getting seriously ill or potentially dying from COVID-19. That work continues. I would note that we are seeing the effects of the childhood, the pediatric doses, increasing our rates, because as a reminder, there have been 96,000 people in Maine who happen to be between the ages of 5 and 11 who are not yet eligible to get vaccinated. That is changing. We also know there are going to be kids under the age of 5 who are not yet eligible. So we will continue to strive to educate those about their first and second doses, hope that the additional authorizations will happen for our whole population, as well as address this issue of waning immunity. This is not an either or effort. This is an all of the above.
Eric, there is one note that I will add on top of what Commissioner Lambrou noted, which is, in every infectious disease, in every disease that has ever been categorized in history, the preference and the priority and the recommendation is always for prevention over treatment. But treatment's important too. And as we talk about COVID, one of the key treatments right now are monoclonal antibodies. Our team from across the state has been working with certain rural hospitals to try to increase the availability of monoclonal antibodies. Would I prefer that we could prevent the disease altogether? Of course. But we have to make sure that if and when people do get COVID, the best available treatments are within their reach. That's one of the things that we're focused on to help try to drive down, maybe not that initial case, but subsequent transmission as well.
Thank you. The second question I had is, we're heading into a holiday week next week. As everybody knows, there's going to be gathering, there's going to be indoor gathering, and there's going to probably be some situations where vaccinated individuals are meeting with unvaccinated and vice versa. You look at models, you look at projections, all of these things. How bad can we expect things to get? And, we've asked a number of these questions before, but what are the thresholds that we would have to reach before something gives? 300 plus people in the hospital per day, every day, 1,000 or more cases every day, 1,200 cases every day before there's some sort of give. What has to happen in order for us to say what we're doing now just isn't enough?
Yeah, I can start at least on the holiday piece. And Eric, if you'll let me accommodate me. I had a bit of a monologue on that toward the end about ways that folks and families can stay safe as we think about the holidays. So I'm going to touch on that at the very end today. But in terms of what next week and subsequent weeks could look like, it's concerning. I'm not raising the alarm bells here. We've raised them and rung them for weeks now. The alarm bells are here. And so the subsequent weeks following the gatherings that we're seeing, next week and subsequent weeks, it will almost certainly lead to more transmission. I'll talk in a bit about ways that we can tamp down on that because it is up to us. In terms of sort of the thresholds, Eric, we're not where we are in the pandemic now. It's not paint by numbers. It's not sort of if we hit X, then we do Y. There are a number of factors that we look at, and when we have vaccines that are available, as well as additional therapies that are out there, it's not as if we hit a certain threshold, then we automatically do X.
Okay, thank you.
Mm-hmm. Let me go to Megan at WMTW.
Hi, thanks for taking my question or questions. It's very similar, obviously, to what Eric was talking about, because I think that that's pretty much very top of mind. But, I think, mental health has been a large and a key player in this pandemic, with people kind of getting exhausted and feeling like they're doing what they need to be doing in order to stay safe. Meanwhile, we're watching case counts go up and hospitalizations go up, and even as more people become eligible for the vaccine. So the booster, I understand, may bring down those numbers, perhaps in a significant way. But are there any more tools left in our toolbox, as we go forward? How do we do it? How do we move? How do we proceed? And how do we kind of backtrack and rewind or go back to kind of where we were earlier in the pandemic, even without the vaccine?
Sure. Let me just begin by saying, appreciate that there are tools in the toolbox and people always look for a new one, but we have the tool. We have a vaccine. We have a safe and effective vaccine, unlike many of our vaccines, in terms of the impact it has on keeping people out of hospitals, out of critical care. And I just want to remind people that to this day, even with this large number of people in hospital beds, almost all of the people in critical care and on ventilators are unvaccinated. We have the tools. We have one important tool that can keep people safe, which is to get vaccinated. All that said, we do continue all of our work to implement all of our different protocols as best we can, with a recognition that we've moved away from needing to do large-scale public policy interventions to keep people safe to trying to do everything we can to promote vaccination, because it's shifted from a public policy responsibility to an individual responsibility. That said, again, we'll continue to work on our protocols. We'll continue to work with our hospitals and health systems to ensure that they have the capacity to treat people with COVID and other patients as well. But I just think we have to remind ourselves that I know people are tired, we're all tired, but there is one way out of this pandemic, which is vaccination.
Thanks, Megan.
Can I just, one quick question about just schools, individual schools. I know that the general policy of the state has been to let individual districts make their own decisions. But as we now move towards winter sports and kids are going to be playing sports more indoors as opposed to outdoors, has the state thought about any kind of creating any kind of outline or protocol or anything that they suggest that schools should follow when considering indoor athletics?
Sure. So back in May, with the end of the state of civil emergency, we stopped doing guidance for different parts of the Maine economy, partly because we didn't have to anymore. The US CDC has issued a wide variety of very solid guidance documents, and to prevent there from being duplicative guidance documents and confusion, we do refer our actors to that. We do know that Maine Principals Association has been working with the Maine School Management Association to develop joint guidance for winter activities. We commend them for that joint collaboration. And we do continue to urge our school boards, our superintendents, and our partners in the field to continue to follow those basic good practices.
Thanks, Megan. Let me go to Brian Sullivan next.
Thanks, Dr. Shah. I'd start by asking if you could shine a little light on some of the things that are going on in the Department of Corrections. Just looking on their dashboard, it seems like there seemed to be an uptick in cases, particularly in Windham or Charleston. So can you just talk a little bit about what's going on, what you're seeing, and some of the case investigations and finding out how the virus is getting into these locations?
Yep, sure thing, Brian. Bottom line here, we speak with and check in with the Department of Corrections every single day to hear about what's going on in their facilities, as well as to get input from them on what they're hearing from county jails as well. Of course, somewhat similar to the increases in cases that we've seen across the state. As you've noted, there have been additional cases at the Department of Corrections. We work pretty closely. We have an investigator, a case investigator, an epidemiologist who works almost entirely with jails and prisons and other correctional facilities. Generally, what we have found is that it varies quite greatly. In jails, it can be just as easily brought in by a resident as it might be by a staff member because of the high turnover. In state-run facilities, it's similarly a mixture, again, based on turnover. So much like any other workplace type of situation, we're seeing a lot of different variations in the way that outbreaks are unfolding. I will note that the Department of Corrections has been rolling out boosters as well as the administration of monoclonal antibodies to try to tamp down on the growth of cases in their facilities. For the specifics, Brian, I would refer you to DOC. They'll have a lot more line-by-line information, but in general, that's where we stand with our work with them.
Okay, and then I guess just to follow a little bit on what Eric and Megan had asked about, and maybe a little broader, you think about the work that's been done and you look at perhaps some projected travel numbers as we head into Thanksgiving. It seems like people are ready to get back to life as it was, at least the 2019. I think TSA travel numbers have it pretty equal. Just take a temperature of what you're hearing from people? Is this life now, or are we just preparing to live with COVID and people are ready to go back about their business as it was? Is that sort of a sense that you're getting?
I have no doubt that there are a lot of folks who are ready to move on. I think that applies to just about everybody. But unfortunately, the virus isn't quite done with us yet. So as much as I think it's useful to think about what a post-COVID future looks like from a societal, from a public health, from a planning perspective, right now we're focused on dealing with the highest surge that we've seen in the state. Could the holidays contribute to that? Absolutely. And so we're concerned. We want to make sure, as I'll talk about in a bit, that we equip folks with ways that they can stay safe for all of their holiday gatherings.
So then again, I just maybe a little more specific. What is your reaction when you see that travel numbers are projected to be back to 2019 numbers with all that's going on in the state?
Well, it depends on who's traveling, where they're going, and who they're going to be congregating with. If they're going to be traveling in a small group and they're only going to be with others who are vaccinated when they arrive at their destination, that's one thing. If they're as a large group that's largely unvaccinated, that'll be mixing with other unvaccinated folks. That has the potential to cause a lot of transmission.
Okay, thank you.
Yep. Let me go to Patty White next.
Thanks, Dr. Shah and Commissioner Lambrou. Dr. Shah, you said that people should be patient about getting the boosters because of potential IT issues. What's our supply like and just the capacity to administer shots? I've heard anecdotally about some people having issues.
Statewide, Patty, we have an ample amount of vaccine within the state of the 3 booster doses, the half dose of Moderna, the full dose of Pfizer, and then a subsequent dose of J&J. We have a strong supply just within the borders of our state. And if we need more, those vaccines are easily available. In terms of capacity to administer the vaccine, there too, we've seen just over the past weeks, as I mentioned, pretty strong growth in our vaccine rates across the state, whether it's at pharmacies, the large-scale sites that are still online, and now increasingly things like doctors' offices and places like that. So I want to encourage folks to get their booster. I think everyone over the age of 18 who got a vaccine should get a booster. It might take, again, a little bit of time for the IT systems to change. It might take another day or two to find an appointment, but we have not heard systematically across the state that there are concerns or problems either with supply or capacity.
Thank you. And Commissioner Lambrou, can you tell us a little bit more about what the state is doing to support hospitals? What's new in terms of capacity and then the Maine response?
Sure. We have intensified our work with hospitals and other components of the health system since they're all interconnected. And that does include providing clarity about the ability for a hospital, for example, to use a rural hospital called a critical access hospital as a way station for people needing nursing facility care. We are continuing to provide resources. Just last month, we provided hospitals with $23 million to be able to support their kind of extra efforts to get staff in this challenging period of time, as well as make the adaptations to address the capacity limits. We also are expanding how we're supporting hospitals with our volunteer program called Maine Response. Maine Response is an emergency health volunteer system that organizes healthcare, public health, and emergency responses in situations like this. We do urge Maine people who have some experience in a healthcare setting to sign up. We appreciate the volunteers that have been helping us throughout the pandemic, and we need your help a little bit longer to give our frontline workers a little bit of a break. So if you have some experience and the time and willingness to volunteer, we really do urge people to go to Maine Response to sign up. I'll also note, though, that we continue to look at all available options. That includes, for example, deploying some rapid response nurses in very targeted ways to alleviate some of the stress, working with our nursing facilities to try to open up beds, because we know that some of the strain in hospitals is less about intensive care. And in fact, we haven't seen as much of a surge in intensive care in the past few months as in non-intensive care. The more we can begin to decompress hospitals, the better. So we're working with our nursing facilities in the coming days and weeks as well.
Thanks. With the Maine Response, are you deploying more volunteers now than you were before? Can you give us any numbers?
We're going to be, yep. So what we're doing is kind of broadening out that concentric ring of circles. We have been really hyper-focused on facilities with COVID-19 outbreaks themselves. What we want to now do is kind of think through how we can help facilities that may not have an outbreak, but have people with COVID-19 or not able to treat people with COVID-19 because they're crowded, to begin to have those volunteers help in different circumstances. But Dr. Shah, do you want to elaborate on that?
Patty, we have an increasing number of volunteers as well as missions that we're tapping and asking people to volunteer for. We'll get you the exact number as of right now of the number of volunteers who have been activated and deployed. It again changes day by day based on shifts, needs, things of that nature. But we'll get you those numbers, Patty. But to underscore once again what the commissioner noted, if you have some degree of background in healthcare and volunteering to help out right now to help your state is something that's available, please register at Maine Responds. We do need your help.
Thank you.
Emily, over at the Sun Journal.
Hi, good afternoon. I wanted to focus on the hospitalization. So you said before, Dr. Shah, that about a third of the people hospitalized are vaccinated. Please correct me if that's no longer accurate. I'm also curious how many people in the ICU are on ventilators are vaccinated, but that seems like a high number for, we know how effective the vaccine is. So can you just dig into a little more like what's going on here and why should people not take this data point as a sign that they shouldn't be confident in the vaccines?
Sure. Emily, let's first start with the numbers. You're right. On any given week, about 2/3 of the people who are hospitalized in Maine with COVID-19 are not fully vaccinated. When you turn to intensive care units and people on ventilators, the percentage who are not fully vaccinated grows even further. At some points, it's been 100% of people in the largest ICUs in Maine who were not vaccinated. Now, you raised the right question. Geez, I thought these vaccines were really great. How can it be this? It has to do with what's called the base rate effect. I'm not going to go into it here other than to say that the right way to look at this is not so much what percentage of the people in the hospital are not yet vaccinated. It's what percentage of people overall who are in the hospital and who are not in the hospital have not received any sort of vaccine. And how do those two things compare? For example, how does the risk of being hospitalized differ based on whether you are vaccinated or unvaccinated? And there, the US CDC has thankfully compiled a lot of that data for us at the national level. And right now, across the country, your likelihood of landing in the hospital with COVID-19 is 12 times higher if you are unvaccinated than if you are vaccinated. 12 times higher if you're unvaccinated than if you're vaccinated. Your question, Emily, still stands though. How could it be that 1 out of every 3 people in the hospital in Maine with COVID has gotten their COVID shots? Well, part of the reason, in fact, almost all of the reason, is that Maine has a lot of folks who are, in fact, fully vaccinated. And a small sliver of them will experience breakthrough cases, and a smaller sliver of them will unfortunately need to be hospitalized. Generally speaking, vaccinated individuals who have to be hospitalized tend to be older. They tend to have chronic medical conditions, all of which makes them even at a higher risk for hospitalization if they happen to get COVID. But something rare, getting hospitalized after a breakthrough case, even if that happens 0.01% of the time, because we have a lot of people in Maine who are already vaccinated, that rare thing that happens 0.1% of the time, when you apply it to the fact that we have so many people who are vaccinated, numerically it looks larger. But the number is not the thing to focus on. The rate is. And that's where that 12 times figure really comes into play.
Okay, thank you. And second question, my colleagues have asked already, what other tools remain in the toolbox. If vaccines are really the best tool, the most straightforward tool to get out of the pandemic, are we just, stuck in this kind of precarious position if there still remains significant groups of people that are unvaccinated? If we're never able to kind of solve this holdout question, where do we go from here?
Sure. Well, Emily, let's start. Sorry, Commissioner, go ahead.
We'll just begin by saying, I think we don't know. I think we can't predict what the surge or Delta variant looks like in the future. But I do think, and this is related to the question about travel and even schools and hospitals, we had to adapt to a situation where there may be always a certain number of people in the state with COVID-19, and there may be unvaccinated people who are in hospitals because of it. This is why what we are doing, in addition to trying to encourage vaccine, is working with our health systems to really try to adapt our capacity models to this situation so we really can make sure that we can treat people who have COVID-19 as well as people with cancer or heart attack or other illnesses. We're working with our schools to think through how do we adapt our school models so that we can keep teachers and staff in schools for in-person learning as much as possible. We're trying to figure out our travel policies. And this is where, again, I think we see, the US CDC maintains a requirement that when people are traveling, that they wear face coverings. How do we begin to adapt to a situation where COVID-19 may be with us for a while if we do have a subset of our population who are not vaccinated? So we are working on how do we adapt our policies to make sure people can continue to do what they need to do, like going to school or getting healthcare, do what they want to do, like traveling and seeing families safely. So we are in this mode of trying to make these adjustments so we can maintain our quality of life and do so safely.
Well, Emily, I was going to note almost exactly what the commissioner noted, which is I think it's useful to start that analysis based on what our goal is. The goal of COVID-19 has never really been to eradicate it. That really doesn't happen with a disease that's so transmissible. It's not even really to eliminate it. It's to control it and ideally to blunt the impact of surges. Right now, we're in the midst of a surge. And so our goal is to blunt the impact that has on hospitals, families, schools, and others. Vaccines remain one of the best ways to do that, to have that blunting impact. But we also have to shore up our ability to deliver monoclonal antibodies, other therapeutics, things of that nature. Those are all the things that we're doing right now in service of that goal. In the future, our goal will have to be, in general, to coexist with COVID-19. Will there be subsequent surges? There may be, in the same way we deal with seasonal spikes of, say, the flu. But right now, given where we are in the surge, our goal is to make sure that the impact of the surge is minimized.
Thank you both.
Mm-hmm. Let me go to Chris Costa next.
Hi, Dr. Shah and Commissioner Lambrou. Thank you for taking the time. I just wanted to get some numbers clarifications first before I ask any questions. I think it was Eric Russell who had mentioned there were about 400,000 people in our state who remain unvaccinated. Is that a number that you guys have? No, Dr. Shah, you're shaking your head. Do you happen to know a raw number on that front?
We can tabulate it really quickly. I think it's probably closer to about 200 and change. Okay. We can run it really quickly though.
Okay. I don't want to waste
Eric. I didn't want to correct Eric, but it's not 400,000. It's a number lower than that. But we can get the exact number.
Okay. No, and I mean, I just to allow the things to keep moving along. I guess where my brain is going is this: how many kids ages 0 to 4 do we have population wise in our state?
Yeah, actually, maybe you know what? Let me just check.
I'm sorry. I didn't mean to disrupt things.
No. So in terms of the 0 to 4, we can get you that number really quickly as well. But okay. It might actually be on the order. Gosh, now Eric, I'm going to apologize to you. We're going to get you exact numbers. Not going to try to do the math on the fly live on TV.
No, that's fine.
We'll get you the exact numbers, both of the number of eligible folks who have not yet been vaccinated, as well as the number in that 0 to 4, which is just 1 minus our population.
Sure, and I'm basically just trying to keep in the mindset of what Commissioner Lambrou and you, Dr. Shah, had said earlier, which is we are working now to get these kids, these 96,000 kids, ages 5 to 11 vaccinated. We know that there is a certain amount of people who are unvaccinated, and we still know that there is a portion of the population, those 0 to 4, who are not yet eligible for vaccination. So I guess what I'm trying to get at is, do we know at a certain point, once we know the population totals for each, section, do we know how many people we expect to be unvaccinated at this point? What percentage of Maine's population? I know that's kind of a hard number to speculate, given that people's opinions may change.
Chris, what I can commit to you is that we will continue to work to ensure that every single person and family that wants to be vaccinated will have access to the vaccine. I can't tell you where we will be at any point in the future in terms of who's remaining to be vaccinated and who hasn't been. Ideally, we'll drive that number as low as possible, but I don't have a theory about where we might land.
No, that's fine. And sorry, go ahead, Commissioner.
No, just that, and we keep finding ourselves learning throughout this pandemic. We learned about 6 weeks ago that we found more people who had been eligible all along, who started getting their first doses. Our rates started rising. I think we've also, in the past, almost 2 weeks, 2 weeks from today, 2 weeks ago from today is when the kids ages 5 to 11 became eligible for the vaccine. We have been pleasantly surprised by the high interest that we've seen among parents and some kids in getting vaccine doses. So we are, again, practically, racing in our schools and our young kids to get the vaccine, which again is a pleasant surprise. So we don't know. We will, as Director Shah said, always strive to get every person, every individual who wants one a vaccine and try to convince the rest of them who don't to get a vaccine. But I do think it's going to be impossible for us to either project what the final, if there is such a thing as final number is, as well as what might be a sufficient number, since again, we keep learning throughout this pandemic.
And, Chris, on a similarly optimistic note, way back when the vaccines were just starting to roll out, I can't remember if it was either you or Patrick or Eric who asked back in the alpha variant, pre-variant days, when we thought that the number that we needed to reach was around 70%. I remember one of you or your colleagues asking, do you think we'll get to 70%? And I said, boy, I don't know, not sure. And yet here we are today at 71.6% of the state fully vaccinated. So we're gonna keep working it.
Awesome. My other question does involve some numbers. I had tried to research them previously, and I guess I'll just ask a quick yes or no question and then to follow up. As far as outbreaks at long-term care facilities, are those numbers posted anywhere publicly?
The long-term care facilities in general, Chris?
In Maine, not at the national level.
No, we don't post them publicly, mainly because they change every hour. And so, as you recall, way early on in the pandemic, for the first 10 or 11 months, I went through the numbers every day with updates and changes, but they are now changing every hour because we're testing so much more, things like that. What I will note, though, Chris, is one observation that one of our epidemiologists had, which is, although those outbreaks have not gone away, they are smaller now than they were in the pre-vaccination era. And although they may involve individuals in those facilities, the acuity of cases is not nearly what it was as compared to the pre-vaccine time.
And just to clarify, when you say acuity of cases, you mean the symptoms that people are experiencing?
The severity of symptoms.
Got it. Okay, because I had heard from some viewers who were concerned about an outbreak at their loved one's long-term care facility, and the natural questions kind of came to mind of, well, wait a minute, if the staff is supposed to be vaccinated and my loved ones and all their fellow residents got vaccinated a long time ago, why is this happening? And I remember you mentioning at the beginning of today's briefing that because we had so many people vaccinated so early, that there is potential to have that kind of minimizing of protection. Is that kind of what's happening here, or no?
That is one part, and to tie it in with today's themes, all the more reason to go get a booster, or for those facilities to arrange for boosters for their residents, which they are doing. That is one piece of it. It's also the case, Chris, that you have two other factors. One is, as their name implies, they are congregate living. You have a lot of people living in somewhat close proximity. They often tend to be older, perhaps have higher rates of pre-existing medical conditions, all of which predisposes them to still being at a higher risk of COVID. Again, all the more reason to get a booster.
Mm-hmm. And just to put a bow on this, I remember that early on in the pandemic, I believe it was the retail pharmacies had been very proactive in helping out with these clinics at long-term care facilities. From the state's perspective, have they been as proactive in the booster clinics as well, or how's that working at the long-term care facilities?
It's a long question, Chris. I won't be able to go into all of it because we still have a lot of questions. But bottom line, commercial pharmacies have been active in administering boosters, not in the same way as before, because there are so many other teams of vaccinators that can go into nursing homes now.
Understood. I appreciate your time. Thanks.
Yep. Thanks, Chris. Let me go to Amy Brown next.
Thank you, Dr. Shah, Commissioner Lambrou. I was looking back at my notes, and a year ago today, there were 246 new cases reported, and we were about to go into a holiday season that resulted in, as we all know, that major surge in January. Today, we have more than 4 times that many new cases being reported, as well as the record high hospitalization rates and record high positivity rate. And no mask mandates or gathering limits. So can you talk about what planning is being done to deal with a post-holiday surge this time around and the possibility of hospitals being overwhelmed?
Sure. Go ahead, Commissioner.
Well, I will just go back to what we said earlier, which is our planning now is primarily about capacity to make sure that we are keeping our hospitals, able to provide the critical care that they do for people with COVID-19 and other diseases. So we continue the work to look at flexibilities that we can offer, staffing options and models that will help, resources that will help get through this period of time, as well as other sites of care, opening up nursing home beds, helping with home health care, helping with community-based care so we really can maintain our capacity. That is one of our top priorities right now, as is working with our schools to make sure that they have the tools like pooled testing, be able to quickly identify cases of COVID-19 so those individuals can be home and prevent the further spread.
Okay. And speaking of pharmacies, as you just were, we are aware of at least one pharmacy in the Bangor area that has been falling behind on doing their regular refilling of prescriptions and so forth because there's so much demand for boosters. And that, I'm sure, is just going to increase exponentially after today's announcement. Is there anything the state can do, probably not within a private facility? I'm assuming you can't send helpers in there to assist with that, but is anything being done to look at where the demand is outpacing the ability of private providers to provide those shots and maybe open up some more clinics as was done with the original vaccines last year?
Absolutely, Amy. As we've talked about here, we've done just that in the Calais area, for example, where there was a high demand for both testing as well as vaccines of all types. And so we worked with the Maine CDC public health nurses, as well as some colleagues from the National Guard, to stand up a site there to provide all of those services. We're looking, we want to make sure that, as you noted, where there's not sufficient resources on the ground, we can help supplement.
Okay, so that planning is underway, and I assume will be expanded because of the expansion today?
Well, if we receive requests for assistance, then we'll take a look at those.
Okay, great. And just a quick follow-up about numbers, sort of. I'm wondering how long, you mentioned people can get a second dose 6 months after receiving a first dose of J&J, but that just kind of brings them up to par with everyone else. Can they get a third dose 6 months after that, or how does it work with J&J?
Amy, the FDA, EUA, as well as the CDC recommendation for J&J is that those who got the single shot get a booster of any sort 2 months after their single shot.
2 months after. Okay. And then 6 months after that, are they also eligible for another one? Okay.
No, after their second shot, they've gotten their booster.
Okay. Thank you.
Mm-hmm. Let me go to Sean Murphy at Spectrum News next.
Hi, Dr. Shah, Commissioner Lambrou. Thanks for the time today. Just wanted to kind of a similar question looking back a year ago, just more broadly now, though, comparing where we were last year to this year now. Obviously, the numbers are much higher, but we also have the vaccines in place as well. So could you speak to a little bit to your level of concern at this point compared to last year? Do you think that the risk is greater? Do you think that things have improved? Or just overall, can you compare?
No, Sean, things are bad. I mean, we've broken a ton of records, as I'll mention, but what differs in a moment, but what differs now as compared to last year is that we've got vaccines that are resoundingly effective. The situation that we are in and the risk that people face is on some level an elective risk. You need not put yourself and your family at risk for COVID-19. If you're deeply concerned about ending up in a hospital, ending up in an ICU bed, ending up on a ventilator, you have a tool now that we did not have a year ago, and those are the vaccines.
Okay, thank you very much.
Mm-hmm. Let me go to Caitlin Andrews next.
Hey, good afternoon, Dr. Shah, Commissioner Lambrou. Long time no speak. My first question, I have a question about the child vaccination rates. There are some pretty significant disparities between the counties on this metric. Do you see that as an issue of accessibility or reluctance, and how is the state looking to address that?
Yeah, Caitlin, I'll start, and then Commissioner, please. And we saw those same early trends in the first weeks of adolescent vaccination as well as adult vaccination, Caitlin. It's really too early to tell. We have made sure that there is access as widely as possible, be it through doctors' offices, school-located clinics, commercial pharmacies, but it's too early to tell whether there's a systematic access problem or whether more education is needed, et cetera. We're certainly keeping close tabs on that. I don't want to even suggest that I'm dismissing the concern. I guess what I'm saying is we need to get more data to have a directional sense of what the root cause might be.
I'll just also add, though, it's relatively new. So we have launched an education campaign called Brave Like Me, and it does provide answers to frequently asked questions, basic information on what goes on with the COVID-19 vaccine for 5 to 11-year-olds that we really hope that parents who have questions look at. We also are encouraging all of our young kids in Maine, or kids in Maine, I should say, to help educate each other. So we still have our video contests or competition that is open for Maine children to encourage other children to get vaccinated. So Maine youth ages 5 to 7 can submit a video until November 22nd. And their school will receive a prize of up to $50,000 to use in promoting physical and mental health. So we do urge all of those kids out there who have gotten their vaccine, who want to encourage others like them to help us, because we do believe we're in that phase, again, only a couple weeks in here, where we want to make sure that people understand the vaccine for kids ages 5 to 11 and encourage the parents and those kids to get their shot.
Yeah, you mentioned child encouragement and, their parents also getting their shot. I'm wondering if we see any connection between those rates, which, as you mentioned, this program is early, and greater vaccination rates. Is this more of a sign of maybe their parents' sentiment on it or something like that?
It could be. Yeah. There are some national surveys that have looked at parental willingness to vaccinate their kids if the parents are vaccinated versus unvaccinated. It won't surprise you to hear that parents who are unvaccinated are less likely right now to want to vaccinate their kids. But Caitlin, there too, emphasis on the words right now. As we've seen throughout the adult experience, what we thought we might be at a year ago, that can change. And that's in large part because of discussions like this, where we talk about the facts, talk about the benefits, things of that nature. So, I'll just mention one interesting data point, and then we can maybe send you the data if you want to take a deeper dive. It's national data, but even among vaccinated parents, they too have a bit of hesitancy or questions around getting their kids vaccinated. We see that as an opportunity. These are parents who themselves got vaccinated. We want to help them make the case to get their own kids vaccinated.
Yep, I will just add that the website that we recommend people go to is bravelikeme.com. Thank you.
We would definitely take that data, Dr. Shah, and thank you. No more questions.
Okay, thanks, Caitlin. Over to Lauren Healy at WGMA.
Hi, Dr. Shah. Thanks for taking my question. My question has to do with pharmacies. So we're seeing pharmacies like Walgreens are only allowing boosters based on the CDC guidelines. And with the CDC not authorizing boosters yet for everyone 18 and older. So what would you say to people who are wanting to get a booster today in Maine who don't qualify under CDC guidelines, but do under the governor's authorization?
Sure. Lauren, as I mentioned, any new change, particularly a change in policy like this that affects the entire state, it does take a bit of time to implement. Commercial pharmacies have to change their own policies, their registration, their IT. So it may take a bit of time. But for someone who really wants to go get a booster today, in fact, I was just on the phone with someone earlier today who during their lunch break went and got a booster. So it is possible, but if a commercial pharmacy is not able, or you're not able to get in for some of the reasons that you noted until they've changed their own guidelines or own IT criteria, there are other large-scale sites. For example, the sites in Auburn and York County are available, and because those are locally run, they can adapt and change on the fly a little bit more quickly.
Thank you. And I also just wanted to ask again about pop-up clinics, because we saw so many of these clinics pop up around the state as we were originally giving out the vaccines. And if we can expect to see more of those, or if we should just be relying on pharmacies for the boost.
Well, a mixture there, Lauren. We still have an applicant. We have a page on our website where groups can still ask for and apply to host a pop-up clinic. In effect, if they can get folks together, we can work to try to get a team of vaccinators to go on site and do those. And we've seen them occur at concerts and things of that nature over the recent months. So we still have that architecture in place to facilitate pop-up clinics. That said, what's different now as compared to even just a couple of months ago is even more widespread availability of the vaccines, not just in pharmacies, as your question was, Lauren, but more and more doctors' offices, more and more places that are just everyday locations where folks are going. I think as a result of that, we've seen fewer applications for pop-ups. But again, as we get into vaccinating kids more, we're ready to do those.
And I will just add that we have this week alone over 90 pop-up vaccine clinics at schools or in conjunction with schools. So we are doing it. We're just doing it in a little bit different way.
Exactly. And the last question goes to Patrick Whittle today.
Thank you very much. I found your diatribe to be closer to a friendly note. I have a question I have two questions that are both coming to me from readers. One of which kind of follows up on what Lauren was asking. I feel that a couple of questions from readers who've said they feel like the confidentiality standards in attempting to get their boosters are kind of scattershot, in that at pharmacy A, they'll have to answer a whole bunch of questions, possibly sensitive ones, and at clinic B, it's just, okay, you're here, we're doing this now, and goodbye. Do you anticipate that's going to change with universal boosters, and what can the state possibly do to address this?
Yeah, Patrick, I wonder if we were answering a similar question. I too got a Twitter tag or something to that effect from someone who was a bit concerned about going to a commercial pharmacy in front of other people, answering those questions, and was there a private room and that sort of thing. I think those concerns are certainly out there, partly because pharmacies and other places have become such a focal point for vaccines, vaccinations, and such. I guess the first observation, Patrick, is that there are options. Again, we're working to get more vaccine into places like primary care doctors' offices, where there's the highest degree of confidentiality. Well, there's confidentiality everywhere, but more privacy from others who might be looking and that sort of thing. So we're working on that because we know that that's a concern for a lot of patients and individuals. More generally, there are different practices across the state. You'll find that some providers go through the questions more systematically. Others ask you to fill out the form yourself, and they rely upon that. Every provider does it slightly differently, but it is all standardized. It's all based on the same CDC patient intake form.
Okay, got it. Thank you. This one's a bit more specific. I feel that a question from a reader. There are some states around the country, including Wyoming, that have been using exposure notifications via iPhone and smartphone. And I don't believe Maine has that kind of a tool online yet. Is there any intention to do that? And if so, is it something that could possibly be helpful here?
Not at this time, Patrick. We did examine those tools earlier on in the pandemic. And I even went so far as to have some separate conversations with the folks, the developers, because the question I put to them is, in an extremely rural state, is the value there? Now, I hear your point about Wyoming, but what we ultimately found is that the population density here wouldn't really have the same impact as it might in a New York or a Boston or a DC metropolitan area. What we found is that the type of exposure notification that really works best is the contact tracing, which we're still doing. Someone's positive, we work with them to identify who their contacts are, and then we enroll them in the monitoring system that we have called Sarah Alert.
Okay, so that's we're probably getting in and out of this pandemic without seeing something like that online here. Sounds like.
Based on where we are right now, that's where we're at right now. Anything can change in a pandemic, but that's where we're at right now.
Thank you so much.
Thanks, Patrick. Before we all wrap up today, I wanted to just go on a brief epilogue about where we are right now in the state, 8 days before Thanksgiving. And as we've talked about today, lately here in Maine, we've been breaking records that, frankly, no one likes to be breaking. Today was one of the highest daily changes in the COVID case count we've ever had. We have the highest number of people in the hospital that we've ever had, the highest positivity rate that we've ever logged, and Maine CDC received the highest number of positive lab reports just yesterday since the beginning of the pandemic. Now, I wish I could bring you better news going into the holidays, but unfortunately, that's not the case right now. The question on everyone's mind, as we heard from our colleagues in the media, is what does this mean for you, your family, and your upcoming holiday celebrations? What I wanted to do this evening or this afternoon before we adjourn is offer a few concrete steps that you can take to help keep yourself and your family safe as we go into the holiday celebration season. The first is that if your gathering is entirely fully vaccinated, and by entirely, I mean everyone, and by fully, I mean 2 weeks after their final shot. Everyone who's going to be at your gathering is entirely fully vaccinated. That gathering can occur in relative safety, almost as if it were pre-COVID times. But most gatherings will not be that way. Most gatherings will be hybrid. That is to say, some individuals who are fully vaccinated, some individuals who may be older, who got their shots months ago, and some individuals, some kids who were too young to be vaccinated. In these hybrid gatherings, the calculus is much harder and will vary family by family. But there are a few things that you can do to minimize the risk of COVID in those gatherings. The first is to have a hard conversation with individuals who may be coming who are not yet vaccinated to see if they're willing to get a shot. Now, hard conversations are hard, but they can pay off. Indeed, a survey not too long ago, a national survey, found that a not insignificant number of people who responded who were not vaccinated said that they would get the shot if they were asked to by a close friend or family member. So hard conversations can pay off, especially as we go into the holiday season. The second thing that you can do is to ask folks to test before they come over. The rapid antigen tests can deliver a result within 15 minutes and are quite reliable for this purpose, so long as they're done right before folks get in the car. Now, rapid antigen tests can be a bit tough to find, but they are definitely out there, and the supply is increasing right now. The next thing you can do is to try to do the bulk of your gatherings around a fire, outside, where there's as much ventilation as possible. And when you are indoors, you can do things to open windows and create more ventilation and circulation. And finally, though no one likes to do it, wearing a mask might make sense based on who is going to be at your gathering. The bottom line is that holiday celebrations can and should happen this year. But the planning for those celebrations should recognize that COVID looms large. COVID takes advantage of the very things that we do when we get together to celebrate. Being together for extended periods of time, lingering over the dinner table, talking, singing, arguing about politics. all the things that make holidays memorable. These are the things that right now, based on where we are with COVID, Maine CDC feels that planners, hosts should take into account as you are planning your holiday gathering. So with that, I thank all of our colleagues in the media for their time today. I thank all of you for taking some time out of your afternoon to hear about where we are. As always, please be kind and take care of one another. Have a good day.